Okay.
Okay.
Ladies and gentlemen, good afternoon, good evening. My name is Lambert Mbom. Welcome to yet another edition of the Lambom Show. Today is Saturday, November 21st, November 2020. Today we are going to be talking about COVID-19 and Africa. Privileged, honored to have on set with me Professor Kenneth Yongabi, all the way from Nigeria. He's a professor in Nigeria, and also there are many other things very exciting for me to be on set with Prof today. In fact, Prof recently got an award, the Marc Bopelet Gold Medal for distinguished contribution to biological sciences. We're going to talk about that, but our show this afternoon, this evening, is going to focus on what lessons from Africa. When at the outset of the pandemic, at the outset of the outbreak, everybody feared for what was going to happen to Africa. And this was based on the fact that Africa is resource challenged. And given that it was a pandemic that had to do with flu-like symptoms, it was contagious, everybody was so scared about what was going to happen to Africa. But then the reverse has happened, because we have had fewer infections, fewer hospitalizations, and fewer deaths. I live in the United States of America, where we are currently struggling with the pandemic, with over 230,000 people dead already. And we are moving towards a phase which is being called another critical phase. Critical in the sense that we are moving into winter, places are becoming too cold. And this is a little bit troubling for me, because I remember when COVID hit, and there was an expectation that when it gets into warmer climate, you will not have that being a problem. But people said, no, the issue is not about the climate. And now we are saying that winter, because of the cold nature of the weather, that is why the virus is going to replicate. And so again, we have had too many contradictions over the last 9 months. And that is to be expected, for the simple reason that, hey, this is something new. Everybody was still grappling with it. Theories that had preceded this pandemic did not work, and we're moving back and forth. So again, like I said, there's a lot that we can talk about COVID, but I really wanted us to focus on why COVID has not been the nightmare it was projected to be in Africa. And there's no better person to deal with this than Professor Kenneth Yongabi. Again, this is about his 4th time with me on set. I really want to thank you, Prof, for making the time. It's not easy from Africa to be able to connect, because there are too many connectivity issues. But then you always are ready to come on to talk about this, to educate the community, to make sure we're able to learn a few things. There may not be anything new in terms of what you want to learn from this show today, isn't it? Because everybody has become an expert on COVID, so to speak. People already know something. They have something to say about it. Every time I've called back to Cameroon to find out about whether people are scared, the one thing I've heard consistently is there's no COVID in Cameroon. Everybody is telling you there's no COVID in Cameroon. And kind of strange, because there was a time when everybody who went to the hospital, we only heard that they were dead, and everybody was like, okay, COVID has really hit Cameroon. And we're waiting for it to get down into the villages. It was in the cities, Yaoundé, Douala, probably because they were doing the testing there. But then it also went down to the major cities. But we have not had the similar impact in the villages. I don't know whether it's because of the testing. I'm going to hear all of that from Professor Anchang. But the big news, the headline for us has been, COVID has not been the disaster in Africa like it has been in the USA, in Europe. And why is that so? And so, Professor Kenneth, I know there is a video. Let me see whether I have that on. you recently had a chat with an anthropologist, DeLuca in I think in Boulder, Colorado, and she laid out 10 points why COVID has not been the disaster people predicted it was going to be in Africa. Let me see what I can pull that up.
Remember that it's got 50 plus countries, there's 3 universities, so it's hard to
Where is it? So unfortunately, I think I'm unable to pull that up to the screen, but let me see what I can just let it play for a while and see what I can get that. I don't know why I'm having that problem. 1 second. So, Prof, I mean, I'll let you take it on because I think I'm trying to get that on. But I'm sure the point first, the one thing she mentioned, you talked about is mortality rates. Mortality rates are not as high as they were before. And she was trying to lay out the 10 things in Africa. One of the first things, I mean, there's kind of a mismatch. We have not done enough testing. And so probably we have not caught enough of the cases. But then how to measure the impact of COVID is not only through mortality rate, it also has to deal with hospitalization rate. And even there are people who are positive, but they are not symptomatic. So again, it's a mixed picture. Let's start from there. How would you measure the impact of coronavirus on the country?
Yeah, thank you very much, Lambeth Mbom, for bringing me again once more on your show. It's always a very big pleasure to be invited on this show and to be able to have this singular opportunity to share my views to listeners and viewers across Africa and beyond. So I would really take the stage to thank you. And what you are doing is very important in the area of public health and education. We call this in public health effective communication and health literacy in a way to be able to take medical information to the populace in such a way that the populace would have access to the right information and be able to use that information to make the right decisions and choices in order to improve their own health care and health, as well as the health of the community. So this is very important, and I'm very happy, and I do appreciate you for this. Now back to, let's begin the conversation on these points you're talking about. At the onset of COVID-19, many predictions were made on what probably would happen in Africa continent. But as you rightly set the stage in your preamble to this discussion, we are not seeing that kind of disaster that was anticipated for Africa when it comes to COVID compared to the other continents and even China. I mean, we've seen what has happened, what started off in China, in Wuhan. And of course, China also had a second wave. We've seen what has happened in Italy. And of course, in some of the European countries, they are also, going into a shutdown, lockdown, because of a second wave. We've seen, of course, what is happening in the US, which is really a disaster. And of course, what has happened in Brazil, which is also a horror. So, in that light, I would say that what we're seeing in Africa is that these models that were used in predicting Africa are not really working, because they had used the model of health infrastructure, that Africa is disadvantaged when it comes to healthcare infrastructure. And when it comes to testing facilities, Africa doesn't have robust testing facilities in their medical laboratory facilities. And of course, being a low resource continent compared to other continents, we would imagine that if we had this kind of disaster in the magnitude of what is happening in other continents, then the likelihood that Africa would not be able to cope in terms of containing this scourge, obviously the results would be mayhem compared to other continents. And of course, also looking at the fact that there are other endemic diseases across the continent. For instance, malaria is there. We also know of Lassa fever in some, spotted parts of Africa. We also know of yellow fever. As I speak, already part of Nigeria is already having yellow fever infection. We also know of Ebola, which all these have already been in existence across the continent. And then when you compare that, more than 80% of the population of Africa is unable to cope, to live on $1 a day, for instance. So you look at that poverty level, nutritional deficiencies, and all these challenges. So all would point to the fact that such model would be revealing. That's the theoretical perception, is that such a model would be revealing that once COVID hit the continent, definitely and for sure is going to be mayhem. But these things have turned out, to challenge this anathema, and that is exactly, would I say it's a blessing for Africa? But let's look at the nitty-gritty in terms of the technicalities. Number one, when you look at the testing,
so Prof,
when you look at it, yes.
Just before you go on, so what you are saying first is the predictive models that were used were just off scale. So that's precise. Yes. That's one of the reasons why. So again, do you think there's a new model that has been put in place now as a result of this model being off balance, or what is it? I mean, from a scientific perspective, isn't it? So are we saying that the Africa CDC has a new model for predicting what is going to happen to the continent when we have pandemics like this?
I'm not sure that there is already a model in existence, but I'm sure that Africa CDC should be studying the situation to answer these questions, why the COVID mortality rate in Africa is low. I think that's a fundamental research question that the African CDC would need to answer. And I suspect, hopefully, that they are pondering onto these issues and trying to obviously find out what are the underpinning reasons for these low mortality cases. Of course, Africa CDC at the moment, if you go to their website, you will see that they still express caution on the Africans. There's still a cautionary statement that Africans need to be careful about COVID-19 and to be able to make sure that they follow the protocols that are laid down to minimize infection and flatten the curve. This is still pretty much strong on the lips of the ACDC. But at the moment now, there is no clear-cut explanation as to the low COVID mortality cases on the continent at the moment now. The video you would have seen, on YouTube by Professor Laura De Luca from University of Colorado Boulder in the US, working and collaborating with me, came up with this 10 points, strategy, trying to explain why the COVID mortality rate in Africa is low. And of course, those points she's raising there were hinged on my research and my, observation, trying to be able to explain what is happening on the continent. There have been too many theories. There have been too many, confusing explanations as to what is happening. So we think we need to be able to put a clear definition and answers as to what we are seeing on ground in terms of scientific backup to this observation.
So let's get into the 10 points. And the first one that I mean, from what I heard, I guess we can call this the 11th point now, because you just added the theoretical model was just off. That's first. That's foundational. So the first thing you mentioned was something about herd immunity, which is something for us in the United States is kind of strange. When you mention something about herd immunity, everybody's like, we don't think that we have herd immunity yet. We have not gotten to that threshold, isn't it? That is why you still have many cities, many states getting into strict lockdowns. Okay, and everybody again is encouraged to do what? Wear masks, do the hand sanitizing, wash your hands as often as possible, and in fact, social distancing. But all these are not things that have happened, consistently in Africa. And so your first thing about herd immunity, first of all, explain to us what is herd immunity and why do you think Africa has attained that level of herd immunity? That is what accounts for the fact that they have not had the high mortality rate from COVID.
Thank you very much. Taking on into this question, from the way you put the question, is very clear that you can see a control point there. I mean, in every experiment in science, you would need to have a positive and a negative control. You've also, as you've rightly said, looking at what is happening in the US, the people feel that they haven't attained herd immunity. Yeah, it takes a while to be able to attain herd immunity. It takes a while to attain that herd immunity. So clearly, looking at what is happening in Africa and what is happening in the US, that's already a control to show that the cases in the US is rather surging, giving an indication that they haven't. Even healthy people haven't attained that herd immunity. And also, despite the fact that I think compliance in terms of hand sanitization, physical distancing, use of face masks is more. I think the adherence level in the US would be definitely more than the adherence level in Africa, so to speak. So that's already a control. Now, looking at what is happening in Africa, that people are not adhering very strictly compared to what is happening in the US, compared to the strict adherence in the US, and yet the mortality rate and even the rate of infection across Africa is lower than US. That already gives you a linear control to be able to start explaining properly what is happening. Now, herd immunity is what? That the population had been previously exposed to similar viruses or similar infections of this nature, and then the body overcame that infection, or some among that particular population were treated of that particular disease. So over time they've been able to develop antibodies that goes a long way to protect them should in case they are exposed to that very infection subsequently. Now, when they are exposed to that very infection subsequently, their antibodies, that exposure to that infection means that you are exposed to the antigens. That is the foreign body that comes in. And in this case that we're talking about, the foreign body is what? SARS-CoV-2, specifically COVID-19 with that particular strain. So when the body is already exposed to that, now you have a new infection. The body already now has that memory in the system. So that memory now is what? That memory initially had produced antibodies to fight. So the antibodies are still lingering in the system. So the antibodies now, having seen that antigen coming in now, produces more of the antibodies to fight against that particular antigen, without necessarily you having any drug or any therapeutic agent. So that's that exposure and that level of antibodies preparedness into the system. So that has gone, hopefully, but this is what we are anticipating, this is what we are hypothesizing right now here, that Africans have been exposed to 1 or 3 or more symptoms and signs of COVID-19. I mean, if you talk about pneumonia, many Africans have had pneumonia, in their lifetime already. If you talk about high temperatures, many Africans have had high temperatures, having repeated bouts of malaria infection. When you talk of, cough and flu, I mean, flu is not strange to Africa. We grew up with flu, and most Africans were not treating flu. Sometimes some are opportune to take vitamin C, some are not even. You find children in secondary and primary schools, having a running nose trace, and that's just normal. So in the course of all that, they've developed what they call immunity, herd immunity to all this. And it's very likely that even with the early infections of COVID that was experienced within February, March, April across Africa, that already with this resilience, with this immune resilience, and with that early infection, some very speedy herd immunity would have been developed. I use the word speedy here, very important here, and I like to underline the word speedy herd immunity. The rate at which we would develop herd immunity would be obviously faster than what you would obviously see in the United States of America or in other temperate countries, because of the fact that they haven't been exposed to any of these symptoms and signs of chronic endemic infections in the past. So obviously, the rate of developing herd immunity would be low. It's going to take a while in that. And then also possibly the strain of the COVID-19 SARS-CoV-2 in Africa. We need to also think about the strain, because I think genomic sequences is showing that Africa doesn't really have just one strain. I don't know whether how many strains exist in the US, but definitely they know that there is a strain that is predominant in the US. So all these things would come into play, and we have to be able to consider this to explain the differential, what is happening in this continent and what is actually being observed across Africa. This is very important, and we need to be able to write a narrative and a story to be able to explain this and build a very clear public health picture and epidemiological picture on this.
So, Doug, thank you very much. But I mean, maybe I don't understand it properly, isn't it? Isn't it the case that even when somebody who has been infected can be reinfected again, isn't it? So if I have contracted the virus and there is a likelihood of recontracting, how is it that, because I must have developed the antibodies already, so why is it that even after I've tested positive and come out of it, I still have the possibility of contracting the virus a second time? We know of people who have contracted it 2-3 times. Is it that they are contracting different strains of the virus, or how is it that this herd immunity is built up if there is a possibility of getting recontaminated, so to speak?
Yeah, that's when it came to COVID, that phenomenon has been highlighted, that a patient who had been previously infected of COVID-19 still stand a chance of getting reinfected. That is true. But the question I'm going to ask here again is, have we experienced this in Africa? Are there cases we've used that to caution Africans that, yeah, having had COVID-19 infection, please, and if you recover, please still be very careful. Make sure that you maintain physical distancing. You put on your face mask, and also make sure that you sanitize your hands and wash your hands frequently. That caution has been given even to patients, patients that have been discharged, been treated and discharged from treatment centers. That is still very clear, and it's still very clear on media that people need to be very careful. That it's not having, gone through a COVID infection and survived does not, free you from any subsequent infection. That's correct. The question I'm asking here is that how many Africans have had reinfection? How many Africans have been treated and have reinfection? We need that data there. We need that statistical data there. I haven't come across that as yet. But that's not to say that you can't get reinfected. Possibly it could be another strain, because if you have developed herd immunity for one particular strain, based on the immunological pattern and what happens in immunological procedures, you're not likely going to have that particular infection. Unless, of course, it doesn't mean that when they develop herd immunity, everybody develops immunity to it. There are people, spotted people in the population who may not have developed immunity to it. That is clear. So, summary points here. There are some people in the population that may not have developed immunity to it. That's number one. Then number two, it's also very likely that the strains vary. And of course, genomic sequencing across Africa, like in Ghana, identified a number of strains of COVID-19. A strain that is related to the one, from Europe, phylogenetically from the European strain, phylogenetically related to strains from Wuhan in China, and phylogenetically related strains from those, in the US. So it's very likely that the strain differs, and obviously having immunity for one particular strain does not preclude you from having immunity from another strain. You obviously still have that infection. So these are the points technically that we need to be able to consider. So I think strain variation, and that not every single person who have had that infection and treated is free from a fresh infection. Different body systems differ as well, and different responses as well. So I think that's probably what would explain that phenomenon.
The second point that you guys came up with was about the age, because I think one of the problems, the reason why many people are dying in the United States is also because of the age variation. So people who are 60 and above, especially if they have underlying preconditions, they are more susceptible, and this attacks them in a different way than young people. So again, can you speak to that with respect to why the continent has not experienced the trauma like it was anticipated?
Yes, truly. I mean, the age difference matters, because if you have the younger people are still having, they have very active immune system, and obviously active immune response system and strategy. Now, when you look at the population of the elderly people above 60 years, to be more precise, they have most people at that age, they have one or two underlying problems, either diabetes, obviously some form of autoimmune disorders, hypertension, some are already precancerous situations and all that. And all these situations that they find themselves, they also compromise the immune system. So the immune system is not very, very, let's call it 100% active. So there's some level of compromise in the immune system. So that also provides that susceptibility for COVID-19 or any other infections that are related to low immunity as well to come in easily. So yeah, and that's this situation or scenario in this particular age group is not very common at all with people, the younger generation, or the young, those found in the age group of the young people who already have a strong immune system and less compromise, so to speak. So yes, now in Africa, look at it again this way. In Africa, 60 to 70% of the population of Africans is actually youth. It's actually in the age group of adolescent and youth. So we would obviously expect that. And if you look at in this sense of explanation that the population of Africa 70% is younger in that sense, then you will obviously realize that the population of African, that youthful population, has a strong immune system as well. And if you look at the African child is exposed to lots and lots of challenges. Like I said, how many children in Africa, how many children of that age group in the US or in the first world, in the developed world, so to speak, how many people of that age are exposed to the kinds of challenges, physical challenges that the African children, the African youth are exposed to, looking for a job, working under very tough conditions, being exposed to malaria, being exposed to different forms of infections, and they're able to cope, and so on and so forth. So if you compare that, you realize that there is even a stronger immunity, in this sense of the word, in this sense of explanation, than you would obviously find for the same age group in the United States, where, for instance, they have health insurance scheme when they go for their flu shots and all that. But across Africa, how many young people go for a flu shot? For instance, when they have a normal influenza virus infection, they don't go for a flu shot. So that way, the immunity is really quite prepared in that dimension. And of course, the older people in Africa, if you look at, you realize that despite the fact that they have underlying problems as well, but they still depend so much on their indigenous knowledge. And of course, they depend on a lot of traditional medicine too. We just did a little survey around to realize that hardly would you find any elderly person across the continent that is not dependent on one form of natural medicine or the other. So this probably is playing a very crucial role in what we are observing and what we are seeing that is playing out today on the table.
So, I guess the problem is a different problem in the United States and maybe across, because most of the schools around here, we have gone to virtual learning, and that is because they didn't want the children to go to school and get infected. And, so I'm wondering if children are not susceptible to being, they may not have problems. Why should we close schools? Shouldn't we just allow the kids to go to school and, because they're going to get it? And maybe I add to that because I know the argument is when they go and get infected and come back home, they're going to infect their parents, isn't it? But again,
obviously,
we have also heard that 80% of people who contract this virus are going to be fine. So I'm wondering whether, I know it's a difficult situation from a policy stand, okay, whether to allow the kids to go to school, knowing that they're going to contract the virus, but they're just going to be fine, even though when they contract and come back home, they may infect their parents, that 80% of them would also be fine. How do you balance that out?
Yeah, it's a very delicate and very tricky balance there. If we, to be sincere and honest, when you talk about shutdown of schools, I think in the very early phase of this pandemic, most African countries, they shut down their schools. But later on, they had to open their schools. Take, for instance, in Cameroon, schools, I think virtually schools were shut down for a very short period of time, and they had to go back to school. And of course, schools were going on. Of course, in Nigeria, for instance, schools were shut down. But then after 3-4 months, I think, schools were open, especially starting with the exit classes. So the scenario you're explaining and describing there more pertains to the US there, more pertains to the US. It's true that obviously when schools, they have to go back to classrooms in gatherings like what you would obviously have, the likelihood of picking an infection, going back home and infecting the elderly people is very, very high. But what I would turn to understand here is that there is a need to do a mass screening. We need to be able to, do COVID screening tests for students. I'm talking now with respect, more with respect to what is happening in the United States. Screen them and send them to school. Then let them follow the the COVID prevention protocol that's already laid down. Obviously, it starts with one person being infected and spreading that particular infection. So, but if you have a class whereby people is being ascertained that no one has COVID infection in that particular class or in that particular school, then of course they cannot. That's more or less call it a virgin population, a COVID-free population. Then they can now respect the COVID protocol that is being laid down by WHO, which is being practiced. Now, when they go back home, it's very important also to know that people back home, elderly, you need to go and do your COVID screening. If we have this screening done very clearly, both at home and with students, then we know that, okay, we don't have someone who has traveled to a foreign destination and is being suspicious that person would have been in an area where there is high burden of COVID, so to speak, and is coming back. But then obviously with the quarantine measures that countries have put in place, if we do our screening internally, we know that we're COVID free, and whoever is coming in would obviously do a COVID test to be sure that the person is COVID free. And then the person would obviously have to quarantine for 14 days to be sure that the person doesn't develop any symptoms of COVID before eventually being released to the population. Yeah, when we do all these measures, then and then of course we keep following the protocols, the sanitization protocols, then I don't see reason why schools should not go on at the moment. So that's more or less specifically pertaining to the United States. But in Africa here, I haven't seen let me say, we haven't had robust screening of schools for COVID-19 in Africa. Take for instance Cameroon. How many school children have gone for screening of COVID-19? But schools are on, even in boarding schools. Boarding schools are on, and none have done this. So, I think the issue of herd immunity and the issue of course, obviously the hand sanitization. I'm not too sure if physical distancing is really well respected. I'm not too sure about that. But if I want to classify what is saving Africans, take for instance what I've observed, it's not just more about physical distancing, hand washing, and hand sanitization or putting on face masks, because I simply realize that these protocols are not strictly adhered to. I would say that herd immunity is playing out, and probably the use of spices and some traditional herbal medication is also playing. These are the two topmost that I would classify based on my empirical observation.
So, Doug, you get into one of the reasons for the 10 points onto why Africa was spared, which is the use of spices and herbs. Let's be specific about that, because at the time when COVID hit and you and I had this first conversation, the focus more was there was this mad rush for garlic, for ginger, and for lemongrass, what is commonly called fever grass. And not only that, there are many people who went into a particular exercise of steaming, isn't it? What most of us grew up using that method to cure fever or malaria. I don't think cure is the right word, but to manage symptoms of fever and malaria. And it seems it really worked for many people, because people consistently did that. And that is to a certain extent, even without doing the testing, because again, the argument against testing is simple. If the people were really that sick, the hospitals would have been full. Even without the testing, you would have seen people. So we have not had that. Okay. So again, what is the role of these herbs, and we may, by extension, African traditional medicine, in fighting and combating COVID in Africa?
Yeah, thank you, Mr. Lambert, for this very important question. There is no, I think it's going to be an understatement if we say that herbal medicine doesn't have a very strong role in combating this infection. What is playing out in Africa, is that apart from other highlighted factors, herbal medicine with traditional medicine has also contributed a lot. We cannot underestimate, we cannot downplay this. I've done a few studies, just a few surveys, to find out from families and even some in diaspora living in the US and in other countries in Europe, how they are coping in this COVID period. And everything on their lips, they will tell you ginger, garlic, lemon, they are taking that, and even hydrotherapy, that is warm bath and all that, steam bath and all that. So yes, this is very, very important. I've also observed we have a working committee, working group at the AU level, and we've just done some little surveys across the continent in different zones to find out, from people who are practicing herbal medicine, and they tell us that within this period of COVID, garlic and ginger was highly sold in the market. That's what they said. Lemongrass, as you call it, which is called Cymbopogon citratus, was becoming scarce because people were hunting for lemongrass, people were hunting for garlic, people were hunting for ginger, people were hunting for cloves and other different medicinal plants. And traditional doctors also registered a high increase of people coming to consult and ask about what would be necessary for them to take in terms of preventing COVID. These are information that we cannot deny this fact. This is very, very important. We need to be able to take this information on what is happening on ground to see how we can use that to explain what we're seeing on the continent. This is very important. So I would like to say that traditional medicine, spice plants, kitchen spices have played a role and continue to play a role. I was traveling on a flight from within Nigeria, and I see that apart from people putting face masks, people were chewing garlic, people were chewing ginger, before coming into the flight. People were also eating what they call bitter cola, what they call Garcinia cola. They were also eating that. And I just took the liberty to find out, why are you eating? They say, oh, no, this is to prevent COVID, should in case I contract COVID on the flight. I said, but you don't have confidence with the face mask? They said, no, they still don't have confidence with the face mask. I mean, yes, they are putting the face mask because they are obliged to put on a face mask. It's obligatory that before going into a flight, you got to put a face mask. But they have confidence in the traditional medicine. Now, in Africa, even when people are attending Orthodox hospital, they still have confidence in traditional medicine. So this is a very important healthcare sector in the continent that has been the dungeon of the people, has been part and parcel of the history of these people, and is playing out very, very well. And I must say this, even in the Western countries within this COVID period, if you go to Britain, the apothecaries, people are buying herbs from apothecaries and buying spices, mushrooms, and that. People are doing that. Even in the US, most of these alternative and complementary healthcare systems in the US, people are actually patronizing these healthcare institutions as well. That to tell you that people have confidence also in traditional medicine. But how to be able to position it within this COVID is what needs to be done, and it's not being done so far. So, in summary, this has played out among the other reasons we're trying to explain about low COVID mortality cases in Africa. And Lambert, let me just quickly say this. We knew people who died of COVID in Africa, but why have their siblings not suddenly died? I know people who had drivers, people who had drivers and stewards, they died of, a few of them died of COVID. But we did not have this mass deaths or sudden deaths. None of them have had their steward died. None of them had their driver died of COVID. So again, what is happening? These are the kinds of questions, public health questions we need to be able to, find out and probe deeply into and try to explain this phenomenon. And this is a very useful thing to be able to probe into this, explain this phenomenon, and see how we can bring that up on board, up to speed on board, and use that for as lessons for other continents to benefit. I mean, we cannot just have prejudice for any one public health intervention strategy. We shouldn't put that prejudice there. We should be able to create, get these explanations, create an integrative approach or integrative, public health intervention strategy that can be used across, all the continents if possible, where possible, to be able to, fight this particular scourge rather than focusing on one particular intervention strategy.
Yeah, thank you, Prof. Again, coming from your mouth is kind of strange for people who did not. I mean, it will be strange for those who have not yet studied anything about you, isn't it? You are a scientist, and so for you to be recommending very strongly the use of herbs, traditional African medicine, to combat a public health pandemic like COVID is kind of strange, isn't it, in a certain sense? But that, like I said, is strange for people who have not yet studied your background, because before you left Cameroon, you already helped the Association of Traditional Doctors in Cameroon to set up some stuff. And I'm sure you are still working. Can you talk again? Can you, for the sake of the audience, just enlighten people about the role of African traditional medicine or African traditional doctors in public health in general, and the evidence that is coming out now with respect to traditional herbs helping to combat COVID-19 on the continent?
Thank you, Lambe, for this again. The role of traditional medicine and traditional doctors in fighting not just COVID or other endemic diseases and even epidemics on the continent cannot be underestimated. They have their shortfalls. We do know that. As a scientist, we know their shortfalls. But of course, they have their strong points. I'm trying to leverage myself on the strong points. As well as, of course, I'm also going to say a few words on their weak points. Traditional medicine, has been with man since creation. It predates orthodox medicine. We know this. We look at this very clear. We know this from history. But we also do know that most of the drugs we also have in the orthodox or allopathic medical care also came from traditional medicine, were inspired from traditional medicine. So what I mean here by saying that traditional medicine plays a role is that whether you like it or not, or whether we like it or not, the traditional doctors are busy still working. We may refuse our clients or patients from meeting traditional doctors for this, because this practice is not well systematized. There's no clear evidence in most cases. We may say that, but I can assure you that 70 to 80% of our population, despite this particular warning, still go to patronize this particular healthcare sector. What does that mean? It means that it is part and parcel of our community that we cannot relegate at all. We just need to go there and find out how this practice is being done and try to systematize it. And that's the effort we've been trying to do. And that's what I've been trying to do back in Cameroon. I mean, to be honest, I don't know traditional medicine. I did courses in pharmacology, pharmacy, pharmaceutical microbiology, drug development, and, phytochemistry. I did that. But when I realized that in doing this, from an academic and research standpoint of view, I cannot have a grounded understanding of the conceptual framework without going back to the origin by studying what the traditional doctors are doing. I need to go back to that origin. And that's very important. And even at that level, even pharmacognosis, they have to go back and understand what the traditional doctors are doing in order for us to do that systematization, to bring in the evidence-based science onto it. So back again into this COVID, what I'm simply saying is that the traditional doctors are treating patients, but there is no evidence at all that they are treating patients, but patients are going there for prevention. They go there to collect herbal medications for prevention or whatever, and they believe in them. But what we scientists need to do is that as much as we know that there's this Herculean call that we need to understudy what they are doing, but we need institutional governmental support to be able to sanction scientists to understudy what they are doing in order to bring in the evidence-based scientific information on the table, and in order to regulate that sector to do the right thing. That is what is missing, and I'm just saying this. Now, I'm trying to look at what has also played out in COVID across Africa. We are having low mortality cases of COVID in Africa. And in the previous discussion, I've just highlighted a few reasons why, trying to explain this. It may not be realistic, it may not be true, but what we are seeing that is playing out calls for explanation. It calls for us to try to explain what could be happening on the ground. And we are saying that it is very possible that traditional medicine could have been playing a role in what we're seeing on ground right now. We cannot rule out that particular fact about that. So it's just meant for us to study what is going on. And we are doing that. We have committees that are doing that. But then African institutions, African heads of states, when I say institutions, that means government institutions, need to pay attention more than ever before on how to regulate this sector and create that evidence-based platform for this practice. There are two practices that I see here: to preserve the traditional medical practice as is being done by making sure that there is safety and making sure that that sector, whatever they are preparing, there's quality into it, just quality and safety. Then number two, by using what they are doing to develop new pharmaceutical molecules against COVID and other infections. These are the two prongs or two streams or pathways that we see as scientists now. Traditional medicine will always remain traditional medicine, whether you like it or not, but they will produce molecules that we can use to develop pharmaceuticals. Like, for example, we know of Artemisia annua, which was being used in the past as a component of traditional medicine, but today we have artemisinin, the coartems, which has been developed from one of its molecules, the artemisinin, which has been extracted from Artemisia annua. But that does not stop the fact that people are still using Artemisia annua in various concoctions to treat fever-related diseases and also malaria. And by and large, you may have heard of the Madagascar COVID organic. The COVID organic was a whole concoction developed from Artemisia annua. Samples were sent to Nigeria. Nigeria has been the first country through the National Institute for Pharmaceutical Research, analyzed COVID organic from the samples that were sent to Nigeria, and they realized that it was simply predominantly, made up of what? Artemisia annua concoctions. And NIPRID, that's the National Institute for Pharmaceutical Research, actually observed that it has no effect on COVID-19. That's the results that they came up with. Now, you can see that it have no effect on COVID. These are the kinds of evidence-based information we want to. Now, Madagascar was, alerted the whole world that they are treating COVID. But then the evidence-based science was not there to be able to look at, okay, what is the safety of that? What is the efficacy of that? Of course, they may have concentrated on producing the quality. Okay, make the extract, try to bottle it, to make it appealing. Yes, that's the quality, but the safety and efficacy wasn't analyzed. And that's Nigeria did the analysis and came out with, okay, they're not too sure of safety, well, but the efficacy isn't there for COVID-19. These are the kinds of strategies, the scientific evidence-based strategy that we need to do with that particular sector of traditional medicine. In Cameroon, I was trying to lead that particular, to push that particular effort. I'm still trying to do that, but of course, it needs institutional support. And that's one of the aspects that I actually mentioned during my keynote lecture to the Cameroon Academy of Sciences, that we need, and they all agreed unanimously, that it is very important to go back to this sector and try to develop two things: new drugs, and of course, the last, maintain that traditional practice in a way that it's formatted, in a way that it can be replicated, in a way that there is quality, in a way that there is efficacy and in a way that it is safe. So that's what I was busy in Cameroon doing, and I'm still trying to do that at the moment. But we need institutional support across the continent. So that is what is lacking. We have to accelerate this institutional support.
Yeah, but
Thank you.
I think part of the reticence or the problem people are facing is, reconciling both is a problem to a certain extent. I mean, from a layman's perspective, because I think it's the same problem for religion, isn't it? In terms of the fact that many people are being asked not to go to certain places because they are Christians. So you give a kind of a dichotomy between Christianity, for example, and religions, indigenous religions that people have grown up with, call them rituals and all that, which is going to get me to my next thing, because even though you have not gone back to talk about it, one of the points you mentioned was, in your interview or with the professor from Boulder University, Colorado, was ancestors. And I found that intriguing, that in trying to look for reasons why Africa has not had the bullet from COVID, we are also referring to spiritual practices. And when you talk about ancestors, I am sure you are really going down to something there that can you unpack that for us? Because I don't think it's just going to meet somebody who is going to throw some carrots on the floor to tell you that no, this is going to work. What did you mean when you talked about the role of ancestors in the fight against COVID in Africa?
Yeah, thank you, Lami, for that. I think this is very, very important. When you talk about health is physical well-being, health is mental well-being, and health is also, spiritual well-being. This is the way you look at health. You cannot define health in isolation without these three components interplaying. That 10 point we mentioned about talking with ancestors, which Professor Laura actually highlighted on the 10 points there, it's not made up by us. I didn't make up that point. We did a survey. We're finding out from people practicing traditional medicine about their perception, about their attitudes, what's going on, what's happening. What do you think, in your opinion, could go to explain what is happening, what we're experiencing, what we're seeing, what we're observing? And that aspect came up. So we thought, and in science, and when you are doing observation, you cannot throw away, you don't create biases in your data collection. You don't throw biases. You collect raw data as it is, and then you begin to interpret that data. And that's very important. So we brought that particular point because they were the ones saying it. And what do they mean? Let me just unpack what they mean by ancestors. You take the traditional African community. They believe on their ancestors. If you go to their traditional kingdoms or their palaces, you will have different buildings there where they say this was left by the ancestors. So if we have problems, plaguing the community, plaguing that particular village or the tribe or what have you, they go there. They have special, call it representative, with traditional names and titles, who are sent there as messengers to go there and talk to ancestors. Lambert, we grew up in Africa. We're not saying that this is right, but this is a culture. None of us, despite our education, despite even religion coming to Africa, none of us have been able to delete this practice across traditional Africa. It's there. What that means is you cannot criticize what you don't know. You cannot obviously accept what you don't know. What is important in science is about a careful observation. You go in there and find out what it is being practiced, and then use the scientific approach to be able to validate and find out what is the evidence behind this. When you get facts and figures, then you can dismiss. The tendency in Africa, and for most of us who I would say we are on transitional educated intellectuals or transitional intellectuals. I call Africans, a group of us, as in transitional intellectuals. What I mean by that is that we grew up in Africa. We never developed our educational system as it is in Africa. We were colonized. So we had to migrate to Atlanta. We had to migrate to Georgia. We had to migrate to Oxford to study. What were we studying? We were studying a different form. That's why we call it Western education. And that Western education did not take time to investigate traditional African educational system. So we need to ask that question, what is our own educational system in Africa? We studied Socratic systems, Greek, you know Greek in philosophy because Socrates, Anaximander, when you study things like Ionian school of thought, Socratic methods, and all that. What did they do? They x-rayed their system, and they had a culture. It was also tied to their culture, their way of thinking, their way of life, and all that. And we Africans migrated and studied that system. So we came back, our system and what we grew up as our dungeon remained in the dark. We never exposed it. We never tried to look at, the nitty-gritty of it, and then of course come up with use the same Western approach, the protocols, in order to do an investigative or explorative studies on what we have in order for us to make informed conclusions about that. That's what we never do. So I now call ourselves transitional intellectuals because we came now and we're trying to practice back in Africa without a sound knowledge of what we grew up with in our communities. So when we realize this, and that was why we were talking with these people, because we need dialogue with our traditionalists. We need dialogue with people who are custodians of indigenous knowledge. We need dialogue with them. And we don't do that dialogue. You cannot dialogue by being dismissive. You cannot dialogue by condemning a people's culture. No. Look at Ayurveda in India. When you go to India, you go to their temples. They've maintained it, whether you like it or not. When you come there, they tell you this is India. So you do it the way that it's been done. And now it's a whole spot for medical tourism. The Chinese medicine is the same. They've been able to systematize theirs, maintaining the cultural flair of it, and people coming to practice it. So this is very important. So what we are listening with, what our treatise with the traditionalists in Africa, which I think is very important, is that we're talking with them, and they're telling us that normally in the past, in those days, many centuries or many decades ago, when there used to be a plague or something that is going to happen in the village, we have what they call the Quirfons, how do we call it? The traditional ruling council, which is so much endowed in their cultures and having an intrinsic link with their ancestors. They consult them to find out to them and say, the ancestors will tell them and say, oh, there's something that's going to happen in the village here, which is very bad. So people should make sure that they stay at home, they should do this. So they gave those traditional protocols, which is what we can call today the protocols for COVID-19. Put on wash your hands, practice social distancing, put on your face mask. These are the protocols. This is exactly almost in the same equation with what the traditionalists in Africa, in our communities, would use to tell the fund, to tell their subject that this is what is going to happen. People should follow this particular traditional precautionary methods. Now, take for instance, look at Douala people and look at the Lela in Bali. In Douala, you hear of the Ngondo, which is almost going to come. Why do they have Ngondo every year, every early December? The Douala people, they go to River Wuri and they send people. And I don't know, these are special people, according to the tradition, who go down into the bottom of River Wuri, and then they bring a message from the ancestor telling them what the next year will look like. And you find that the government is sponsoring part of that. You find that the brewery companies and the communication companies are sponsoring part of that, and it's a tradition. They do that every year. Have we been able to study, the mechanism of what is happening? And then they'll come back and tell us that there will be a scorch. this particular year is not going to be a good year. People should stay. They give the message and the precaution on how people live, and people believe in that. Now, Lambert, the question I'm asking is that how far and how long do we pretend to avoid a reality that has been existing with people in Africa and will continue to exist? As scientists, we must probe into that. I remember when Reverend Father Humphrey Tata and Reverend Father Isaiah were doing some studies in womb about how thunder is being sent, about how rain is being stopped, whatever, and they came up to realize that it's just about playing with photonics, playing with particle theory. In physics, it's a physics mechanism. But without that particular study, we would be caught up in this opaque reasoning by saying that act is very bad. We condemn without this scientific explanation. That's what we're trying to say. So in the COVID-19, we're like, these people are telling us that they also consult their ancestors to hear what the ancestors are telling them about. Is this a terrible scourge? How do we live? They have to. They don't have to. That's what they were telling us. So we thought that we should make that narrative and then probe carefully into the scientific explanation of what could be happening. Is this something that can be weaved into COVID control protocols or not? It is not us scientists to have the facts and evidence on the table, and we use that in drawing conclusions and making recommendations whether it's an important strategy to be used in epidemiology. Whether like it or not, people were living many centuries ago before Western medicine, before all this medicine we're talking about. We're not living. If you look at the Com Kingdom, for instance, people were living without hospitals, but they were living with their traditional hospitals. And they were doing all this that we're talking about, and it predates, conventional medical system. So all we're trying to say here is that we simply reported what we collected from these people, and we were simply saying, could that be of any relevance? And even if it's not of any relevance, what is the science behind that? Can we explain? Can we probe into it? Can we test this hypothesis? We're taking it already now as a hypothesis. Can we test it? Can we test and reject that hypothesis? So that is very, very important.
Thank you very much. And if you're just joining us, you're listening to Professor Kenneth and Chang Yongabi, calling all the way from Nigeria, and we're dealing with COVID-19 and Africa. Our topic for today is why and how Africa missed the COVID-19, the effects like was predicted. It was going to be a disaster, COVID-19. So, Prof, let me push back a little bit. I appreciate the fact that it's a survey, and maybe it's not a correct estimation of it, in the sense that, is it playing a real role? I mean, when the belief in the work of the ancestors, is it a real role, or is it maybe some psychological thing? If I believe that this thing is going to help, I mean, I've laid down a condition that makes it easy for the thing to happen, isn't it? So where I'm going to with this is, should we just go back to those systems and say, because this is the way they operated and this plays a role in this, let us now give it a certain value? Would there ever be a point where you can say, no, this is a cultural thing and this is wrong? Can we ever put can we give a value, positive or negative, to the cultural experience of a people, especially when it comes to a pandemic, a health pandemic, with scientific evidence that you can see that is facing you? I don't know whether my question is clear.
Your question is very clear. Sure, why not? Why not? We should be able to. It's not all the cultures and practices, in traditional Africa that are correct. And I will give you a very clear example about that. Take, for instance, in Africa, where in some cultures they use this bat as a traditional meal for some traditional occasion or traditional function. And we do know that bats are actually vectors for what? Even for Ebola disease. But the people have been using it as tradition for ages. They've been using that as a traditional meal, traditional protein for ages. Now, we realize that it's actually a vector for the transmission of Ebola virus. Now, How do we convince these people? Do we tell these people to continue to eat bats when we know that they are going to be exposed to Ebola virus? Of course, we need to walk them out of that. And the only way we can walk them out of that is to bring the evidence on the table to this tradition that, yes, although you've been using this for, since antiquity, but this practice is dangerous in this dispensation. Look at what is happening today. So we need to dialogue with the people, especially when we scientists have come up with that particular evidence. Then we cannot approach community to be able to enable community to adapt to existing reality. And that way, they should be able to change their culture or readapt that culture because of an impending danger. So it's not all these cultures and all these perceptions that are correct. So, but then of course, it is the role of the scientists and the intellectuals to be able to come up with the right procedures for educating these communities to obviously understudy what these cultures are doing, look at the harmful effects and the the beneficial effects and the harmful effects, and put them on the table. And in order to educate them for a change, a change will come in based on evidence-based change or behavioral change. Yes, that's very important. And I would like to say also, I give an example. In Boyo division, there is the meal called the kati kati, where they have big lumps of corn-based fufu, as they call it. And then, of course, they roast the chicken. In most cases, the chicken is not well roasted, it's not well done. And they mix it with a lot of palm oil and salt. Now, people are obliged to eat that. That is what the ancestors of Com had put in that when you go to what they call in Com, for most of these death celebrations and or whatnot, they do that. And of course, that has been a practice since antiquity. But if you look at the high salt content, we haven't educated people who are hypertensive that the high salt content is actually, predisposing them to hypertension. Look at the amount of starch they take in the fufu. And these are people who, some of them are diabetics, and they haven't known their status, they're eating that. So in that sense, that meal, although it's a cultural and ritualistic meal ordained by the ancestors of that particular kingdom, it's only by coming up with the science and saying, hey, this salt content is not good for people who are hypertensive. This oil here, is as raw as it is, it has high cholesterol, so it's not good for people. It's actually predisposing people to cardiovascular problems. And the way this meat is cooked, have cooked or what have you, you could actually pick parasites of certain protozoan infections or helminths or what have you. Now, it is only by having this evidence-based science that we can approach the village and say, can we modify and reduce the salt and reduce the oil? Can we now change this? So we cannot just by looking at that and approving the meal, or in other words, or start by criticizing it. I cannot just go to condemn it without giving this evidence. So scientific evidence is very key in all these things we're talking about. We need to understudy all this and bring out the proofs of that. So in other words, back to this situation of COVID and talking with ancestors, yes, we did a survey and they are telling us these kinds of information. Whether you like it or not, even if we condemn them, they're doing it. They're doing it. But like, more people are going there and they believe it. Yeah, it's psychological. It gives them that psychological comfort and it gives them that mental healing that, okay, ancestors have told us that this is not going to be a problem. We're happy about it. And the question we're asking is, this is not just a question we're asking, but this is what we had observed on the field. And we're also asking this question. You are condemning something. We can sit down in our comfort zone, whatever, as scientists and intellectuals, we're condemning it. But the villages that you rightly said in the beginning of this conversation, that even in the villages, they have not been experiencing COVID. And when you call them, they say there's no COVID. Have you asked that question? Why do you talk to these people and they tell you authoritatively, unequivocally, that there is no COVID? have you tried to find out how they arrive at that conclusion of saying that there's no COVID? This is very curious. Where did they get their information? Was it government that told them that there's no COVID? Was it just an empirical observation that they see that people are not dying, whatever? There is more to what they are saying. And you rightly said that there is little COVID mortality, if at all, even there is in villages. How do the villages live? They live with their traditional kings and chiefs and all that, and they consult their ancestors. Whether we condemn it or not, they are doing it and they'll continue to do it. So the best thing for us to do is to do the survey and then try to understand what's going on there. And we bring out the evidence-based science, and then we come up with protocols to inform them that what they are doing is wrong or what they're doing is right. And what they're doing is wrong and right, but this is the way we think they can actually use it to correct and perfect and format what they're doing. That is the role of scientists now. That's the role of intellectuals now in this particular case. So we cannot, by any measure and by any standard, dismiss, but we cannot by any standard or any measure accept. Science is about careful investigation. But what we want to assume now as an assumption now is that all these factors we've just highlighted could be playing a role to what we're seeing. What we're seeing on the continent, the models that were used to predict the models that are used to predict mayhem, the mayhem has not been seen. It's just but normal for you to reject that hypothesis that they had been used initially at the onset of this pandemic, that Africa is going to have a worse hit scenario. But right now we're not having it. The question is, can you put a finger to one single explanation as to why we're not having it? It could be a conglomerate of factors. And we've just highlighted a number of factors. We could not go in detail now to find out which of these factors, in terms of ranking them, would have played a predominant or fundamental role in what we're observing. Again, this is where research, designs, and scientific investigation would have to come in. So, in summary, again, I would like to agree with you that, yeah, consulting ancestors could just be psychological complacency. Give them that sense of fulfillment, that sense of happiness, and that kind of thing. And then even go back to religion. It's about faith. If you look at religion, it's about faith. We're believing in God. We have not seen God. It's about faith. And then, of course, even in the Bible, the prophets were there. Prophet Jeremiah predicted. People were going to see the prophets. People were going to talk to prophet and find out, prophet, what's going to happen? And they will tell you that there will be a famine. There will be something will happen in Sodom and Gomorrah. These things are things that exist. And all we need to do is to find out what's going on. Is there a way we can substantiate with evidence? So the highlights we've given there are no jokes. We just need to rather expatiate, design the experimentals to find out which of these factors are playing a role in what we're observing right now at the moment. So some of them we cannot accept. We definitely cannot accept that ancestors, there is no facts about that. But the fact is that people are doing that. And since people are doing that and you can't stop them from doing that, no matter what you say, then the best thing for you to do as scientists is to investigate. We must do investigative science and get the facts and use it for evidence-based planning. Thank you.
Thank you very much, Prof. Again, before we run off this section, because we are really being much on it, and I have two other things for us to discuss before I let you go. It's a controversial thing that I want to say now because I'm getting into the aspect of vaccine. Okay, there are two things that have been happening. One about medication. The controversy started off when we started talking about hydroxychloroquine. After a while, everybody that went away died down, and today we are talking about vaccine. Currently, everybody in the United States is anticipating what is going to happen to the vaccines. And there is a huge debate about whether or not people should go and take vaccines when they are available. Should we be vaccinated or not? And that is because, again, when you have a multi-millionaire or billionaire like Bill Gates involved in it, and you have all these conspiracies as to wow, this is going to change your DNA, and there's going to be something there that's going to tell people who you are. All that conspiracy. What is your take about the future of vaccines as it relates to COVID? I know it's a huge topic, and I'm planning to come back because I think we had talked about it a long time ago. I'm planning to have a session again just on vaccines because is such a controversial thing. It has always been. It's not just with COVID-19. The polio vaccine that came up, there was something that happened, especially when they're bringing them to Africa. There's always this thing about depopulation. They're coming to depopulate the place. That is why they're coming to use us as guinea pigs, as rabbits. Don't go for the vaccine. I'd like you to just, I mean, given the context of COVID-19 that we're discussing in Africa, what will be your admonition as a public health expert?
Yeah, thank you. This is a very important question. Of course, Lambert, all your questions are very, very important, especially at this critical times in the global history of mankind. Let me, before I go into the depth of my points, let me make this sweeping statement. This COVID pandemic, I'm afraid to say that it has brought all kinds of people on the public health stage where everybody is claiming to be an expert. And all the things, if not all, I mean, most, if not all, of utterances from different experts across the world seem to be failing. The dynamics of COVID keep changing. Today, you mentioned the hydroxychloroquine, where people came out with that substantial evidence that hydroxychloroquine is really used to treat COVID. What I mean by substantial evidence, whereby you would have pulled all the different fragmented, research that have been done to show that hydroxychloroquine is actually treating SARS-CoV-2, to do what they call a meta-analysis. A meta-analysis to statistically, confirm that there's a significance in what we're talking about. People rush a lot to make declarations that are, unbecoming and very unprofessional. So we've seen a lot of unprofessional, proclamations and unprofessional utterances in public health domain, which is so disgusting. Even in the US, even in Western countries, where people want to, I would say sometimes very cheap popularity too across the board. We need to be very careful about this. We need to be very, very careful. I think, again, we need the science, we need the evidence before we come up. And evidence, scientific evidence, Lambert, it takes a while. It takes some thought processes. Real scientists, rigorous scientists don't rush these things. They go through very carefully to analyze data statistically, using different statistical tools and using different, pooled published papers or pooled research works across in order to arrive at a certain, defining scientific conclusions for decision to be made upon that. And that's exactly what has been missing, maybe because of this urgency of this pandemic and the challenges that it has posed. A lot of errors has been made in terms of making these proclamations, and we need to be careful. Now, and that holds with the vaccine. For me, and in my experience, I think the world is focusing pretty much only on one intervention, and that's the vaccine. There are many interventions. There are many interventions to it. Yeah, vaccines are exceptionally good because of the fact that it prevents. We know that without vaccine, who knows, we might have still been having smallpox today, might have still been having chickenpox today, might have still been having measles. Vaccines have played a very fundamental role in public health, in preventing many diseases. Polio, look at chickenpox, rubella virus, measles, yours. Yes, it has played a very important role. So we cannot, by any measure and by any prejudice, underestimate what vaccines will play. That is very important. But what the world is not doing is that the world is not also looking at other intervention strategies which exist and giving equal attention to other intervention strategies. Vaccines alone cannot solve all the public health problems that we have. That is very clear. Even when they have, BCG vaccine for tuberculosis, we still have tuberculosis. Still, yeah. Even when we're talking about, problems of yellow fever vaccine, we just had an outbreak of yellow fever just this week in states of Enugu in Nigeria. So they still exist. So what we're trying to say is that the world needs to focus on other interventions as well as vaccines as well. That's number one. Now, number two, there has been little vaccine literacy. We need to educate people about the importance of vaccines, make people, especially Africans, to have access to vaccine information, allow them to make decisions, allow them to willingly offer themselves once they are convinced of that information. That's not been existing. That's the problem. That's why you find that there's a lot of vaccine conspiracy theories. I don't want to go into whatever conspiracy theories may be existing. That's not my position right now. All I'm saying is that I want to claim that I don't know that there's any existence of conspiracy theories. I want to claim that. But what I want to see in front of me is that, tell me, this is the way this vaccine is being produced, which we all know, following vaccinology and all that. But tell me, this is the way the vaccine does. This is the information about the vaccine. Put it clear for people to see and educate the masses. Let the masses have access to that information. Process the information and be convinced about what it is, and then let them be the ones to go and collect vaccines. That's the way it's supposed to be. That process is not being done. So there's so much, clouds. I would say, nimulus cloud. There's so much dark clouds about vaccine because people don't understand what's going on in the laboratories, in the production process of vaccines, and what's the purpose of that. So that cloud has enabled people now to draw different conclusions and build different prejudices, around vaccinology and vaccine, and especially for COVID-19. So there must be, going forward, vaccine literacy. That is very, very important. Now, for COVID-19 vaccine, you can still see that we're moving up to a year right now, and the race for vaccine has been running. Russia came up with the vaccine. I mean, if you go to the vaccine registry, I'm sure there are so many, companies and groups that have registered their vaccine, but they failed. Along the line, they will announce 70%, 80%, or 90% efficacy. Along the line, one little thing will crop up and it will fail because they are still working on that. That tells you it's a challenging field, challenging area to be able to have an effective vaccine. And people are also wondering, because what is vaccine? You are giving the life attenuated COVID-19 back, injecting it back to people to enable the people to develop enough antibodies to fight that infection eventually. That's the whole process. And people are wondering, is the life attenuated COVID-19 that you're going to inject in me, are you sure that it's not going to, come up with full-blown infection? So that confidence, the scientific community need to provide that confidence. The layman on the street needs to have an answer for that in order to build trust and build that confidence. So there is the new phenomenon or new word we've been hearing today, vaccine hesitancy, which I will hesitate to use the word vaccine hesitancy. What is vaccine hesitancy? That people are hesitating. Even the frontline medical workers are, you make a survey, you find out people are like expressing doubts about the willingness to go to take that vaccine in the event that the vaccine is available. So even the medical health workers haven't developed that confidence as yet. Then what more of the people on the street, what more of the lay people would they develop that confidence? And of course, also looking at the clouds around, the nimbus cloud again around vaccine, when you had utterances in the past about coming to test vaccines in Africa, that was put forward. And Africans, reacted violently. I mean, when I say violently, they reacted on social media and on different mainstream media about that. But so that has already created, an endemic, prejudice, almost to a proportion that it will be so difficult to delete, but not insurmountable because it can be deleted, and it can only be deleted with what? creating a vaccine literacy where people have developed the confidence and they're sure of what they're going to take, then they'll go in for it. They must be sure of the safety, they must be sure of the efficacy, they must be sure of the quality. And to vaccinate, to bring that vaccine in Africa, if you go by different declarations, what they call the Community for International Organization for Scientific Research, what they call SIOMS, 1994, 1993, they said that for a vaccine to be used in any country, the country that has developed the vaccine and sponsored the vaccine, they must start the clinical trial in their own home country. The sponsoring country must be the first spot where the vaccine is tested and trialed before moving to any other country, following the SIOMS declaration of 1993. And of course, there are ethical procedures. So Africa needs to, yes, I know the REACT is good, but we also need to know that there are conventions. There are scientific laid down conventions for testing, doing a clinical trial on vaccines. Countries are queuing in for what they call the Solidarity Vaccine Test clinical trial. Yes, that's good. But these conventions are existing. We have the Nuremberg Declaration of 1884, which all the procedures of running clinical trial must conform to. We have the Helsinki Protocol of 1994. We have the SIOMS, Council for International Organization for Medical Science, which states that, of course, for any vaccine, any country sponsoring a vaccine, test it in your own country, get the results before you now move to any other country. So if we understand this, if the scientific community in Africa understands this, and the institutions in Africa understand the ethical issues, inscribed in Nuremberg Declaration, inscribed in the Helsinki Protocol of 1994, inscribed in the SIOMS 1993, then we should not have any call for any alarm. Governments and institutions in Africa need to understand these protocols, and they have to adhere to these protocols and standards. So moving forward, the ethics, the literacy, and then the safety, the quality, and efficacy. All these things must be put very clearly on the table. And last but not the least, the world, and especially Africa, we need to also bring on board, concomitantly, other public health interventions. We cannot just focus only on one particular pathway. Vaccines, but other therapeutics are there. So that, to me, is the way to move forward. Thank you.
Thank you very much, Prof. I know that people have a certain history of these vaccines and the harm that it has done in some communities, and the documented history of vaccines that the US used in some parts of the world. I don't want to get into all that, but again, the one thing that I have to say, or two things about vaccines, are: one, an abuse never takes away a use, not necessarily, isn't it? The fact that it was abused in one sense doesn't now mean that you are going to now abandon everything. Secondly, I think if there is some proof, the evidence that you are talking about, you are able to see that it's working, why not? It's better to take it and see exactly. And I think the problem with us is we only want others to test and it works for them, then we go and benefit. How about us too coming up? I know there were three vaccine trials that were being done in South Africa, and I think one of them was abandoned. I don't know the history of the other two, but like I said, we're going to have a whole show dedicated just to vaccines so that we can look at it. I want to transition to something which is personal, because again, I think currently what I've seen is many people are moving towards a plant-based nutrition. We already talked about during this show in relation to COVID. We mentioned the fact that part of the reason why Africa has been resilient in the face of COVID is because many people focused on herbs. And I've seen that the people are moving away from whatever form of nutrition they have been, animals and all that, and they are now focusing on plants. And the award you won recently, which is where we are going to end up, I wanted us to talk about this company that you have. Okay, unfortunately, this video, I've tried it twice. It's not coming. I don't know what is wrong. STK-Biotech.com. I'm going to put that up. let me see whether. Give me a second.
Okay. So let me maybe I'll just before I say a few words on the issue you've just asked me, let me just quickly say something on vaccine in Africa. I think in one of the conversations I had with you earlier on in the year, I think I remember saying that Africans, they need to start working on their vaccines, how to develop their vaccines. Africa needs to work on their vaccines, and this is very important. Africans, scientists, and the institutions in Africa, they need to have accelerated dialogue, what they call science policy dialogue, and it must come in with investment. They also need, public-private partnerships with scientists in order to develop the pharmaceutical sector. The pharmaceutical sector in Africa is really lacking because most of the drugs we have on our shelves, in our pharmacies in Africa, are imported. They're imported. So we need to accelerate pharmaceutical development in Africa. We need to accelerate vaccine development in Africa. So there is a committee at the level of WHO on pharmaceutical and vaccine regulation called AVAREF. I sit, I have been a member, not really directly a core member, but we get invited into that committee, which is basically looking at regulation of pharmaceuticals and vaccines. And mostly it's been activated recently because of COVID-19. I think we've attended like 3-4 meetings on that. What are the procedures and regulations in force that need to be used to regulate vaccine? So moving forward, Africa needs to step up pharmaceutical production. They need to step up vaccine production across the continent. And I think COVID, this is a lesson. This is a challenge. These are the perspectives that Africa needs to really do. And it's not just about scientists. There are scientists who are able to do that. But we need a government institutions. We need public-private partnerships. We need, public partnerships with scientists to accelerate that. Now, on the nutrition, there's no doubt that nutritional therapy is very important because it goes a long way to boost the immune system, help the T helper cells, and increase, immunity to handle issues of cytokine storm, which we all know, which is very critical for this COVID infection. So nutritional foods are there, which have what? Protein, essential amino acids, zinc, selenium, vitamin A, vitamin B, So these are foods that are very, very important to build up the immune system. And I think, in a way, Africans, a lot of them from our observations, they were focused on herbs and foods and vegetables that have all this compound. And we do know the role of zinc in what, zinc is inhibiting the multiplication or replication of viruses, and including coronaviruses as well. We know that role. We know what it means, selenium, for instance, what it means. And, and we find this in vegetables, common vegetables like, Amaranthus spinosa, which is called a green vegetable leaf. We have the huckleberry, which is a solanium. We have garden eggs, which is also solanium incandum. We have, pumpkin, which is Cucurbita pebo-styriaca, Cucurbita maxima, which are all pumpkin from the pumpkin family, which is very nutritive, having macro elements and micro elements which are essential in building the immune system. We also have mushrooms, which we do know they have what? They have essential amino acids. They have a whole plethora portfolio of minerals, vitamin A, B1, B2, pantothenic acid, which are all, nutrients, micro and macronutrients that build up the immune system. And Africans have been, aggressively been focusing on these nutritional therapies. So our company, which is called the STK, apparently named after Stanley and myself, Kenneth, as STK, we built up this company geared towards, exploring and exploiting these nutrients, these therapeutic nutrients from vegetables and food plants to put up what we call the biopharmaceuticals. And we've done that, and we have 6 products. These products are basically for cancer. And of course, we do know that cancer is actually a predisposing factor and forms also a comorbidity for COVID-19. We have a product for diabetes, which is called the STK-Rev, which is anti-hyperglycemic. We have a product for weight loss, which is called STK-Luzi. We have a product for, for sickle cell, which is also a nutraceuticals as well. We have a product for HIV that boosts the immune system and with a mild antiviral activity. So it also, decimates the viral load right significantly up to about 95%, which is also very critical in terms of building the immune system and rejuvenating cells that are worn out and bringing back the system and improving longevity and increasing longevity. So we have that product. We also have Hepatosome, which is one of our very good products. All these products have been registered. They've gone through, the National Agency for Food and Drug Administration regulatory process. So the Hepatosome is actually nutraceuticals, which helps the system to build the system and get rid of hepatocytes. Hepatitis virus, both non-viral hepatitis as well as hepatitis as well. So we have this product, and then 2 of these products called STK Booster and STK Phytoimmune is being, based on the mechanism, is being repurposed right now for tackling COVID-19, because we've actually had cases who went down with COVID-19 very seriously, and they recovered just being on STK Booster and STK Phytoimmune. So at the moment, as we speak, the production is going on, following good manufacturing practices, GMP, and the production is also built on standard pharmaceutical practice as well. The extraction, the processing, and all that. The safety is there, which has been confirmed. The quality, we go through different quality assurances in the factory, in production, value chain, which has been verified by National Institute for Pharmaceutical Research, and also been verified by the Pharmaceutical Society of Nigeria. The video just played there was actually, shot during the visit of the the executive members of the Pharmaceutical Society of Nigeria, and you heard the president of the Pharmaceutical Society of Nigeria speaking after a validatory, a visit to the factory, and also validating our production system as well. So these two products are being repurposed for COVID-19, as I said, and we've just written a clinical trial report, a clinical trial protocol to see at the level of the African Union. We're still waiting to see. They are still editing the protocol, and we hopefully in the days ahead to hear the outcome of whether the protocol has been approved for us to be able to run a clinical trial. So it's part of this invention that and others, because we've actually built a system for purifying water using plant-based technology, which is the first in Africa. And we built it in Boyo Division, which is in Bali Kumato in Boyo, which is serving the Government Technical College Bali Kumato in Boyo Division and the community there. And we built that system since 2012, and it's still functional till today, and the community is using that water. And that's the first ecological water treatment system that does not use chlorine, does not use alum. And in the era of COVID-19, if we tell people to wash their hands when they don't have clean water, then it's like throwing water on a dog's back. So, we need to be able to create innovative resources, create avenues for innovative resources, create avenues for innovative tools and innovative knowledge if we want compliance for COVID, for people to be able to comply with COVID protocols. Just tell them go and wash their hands and they don't have clean water, I can assure you that they're not going to wash their hands and they're still going to contract COVID. So that's the kind of considerations that we had, and the Academy of Science of Cameroon, going through the contributions we've made in terms of the African public health system, which I've studied extensively, which is different from the Western public health system. Very different, and we have a lot to say about that. Could be another discussion in itself entirely. And then the hand sanitizers, which we've been able to produce using 100% local materials, synthesizing alcohol from sugarcane, producing alcohol from watermelon, distilling alcohol from watermelon to be able to produce our hand sanitizers. It's an innovative work that we've done, and and the African Union is actually working. They've actually been publishing one of my books on that. Today they told me this book has been translated in 4 languages, and we're going to be running webinars by 8th of December. I'm sure 8th, 9th of December, Lambert, I think I would also inform you so that you can attend that webinar on water purification. So just mark the date on the calendar so that once the advertisement comes up, I would like your organization to be part of that AU water filtration seminar coming up. I'm going to be the lead person. And the book, the AU has published a book. I'm going to get a copy in 4 languages. Just told me today that they have published it in 4 languages in the world. So that's very, very encouraging to hear that. So it is on that note that the Cameroon Academy of Sciences understudied what I was doing in terms of contribution in African public health, contributions in biopharmaceuticals, contributions in bioengineering, because we produce a simple first aid kit for African households, a simple first aid kit for African households. And we also produce phytomedicine, different phytomedicine. For example, we have a project on producing plaster of Paris using only local materials, and we call it Plaster of Africa. So looking at all these little projects, the Cameroon Academy of Science, unanimously voted that I should be given the first Marc Bopelet Award, which was actually given to me in Yaoundé at their invitation. And I went there and I gave a keynote lecture as an invited guest, and I received that first Marc Bopelet Gold Medal alongside with Dr. Kengason, John Kengason, the director of African
CDC.
Center for Disease Control. He received the second Anomangu's medal for contributions in medical science. So we're the 2 gold medalists that were honored by the Cameroon Academy of Sciences. for extensive contribution to translating, indigenous knowledge, in public health, in other areas, and also steering Afrocentric research in developing Afrocentric strategies in responding to system. Now, I'd like to end here by saying something, just one word, just something food for thought, that at the moment, Americans and the West have not understood how to tackle COVID. And I must say this very, very well. They haven't understood how to tackle COVID, because I look at their clinical strategy, their clinical workup programs is far from being anything to write home about in terms of how they are tackling the COVID. Sometimes you need to listen, you need to pay attention to even animals that don't have, that you consider as dumb. Sometimes they may have their own story. I think when I read Desiderata, I get so encouraged. Listen to the ignorant. They too have their own story. I think the West has to listen. There are ignorant people who have a story. I look at a clinical workup program, and we think that we have clues into how to build a clinical workup program for tackling COVID, which is very, very holistic. If only Americans and other Western countries could listen to us, also in Africa, they may just have that clue. They may just have that shot to be able to, take care of this particular pandemic. Thank you very much.
Thank you very much. And you packed in a lot into this last slot. I really wanted you to talk about two of those products. STK Lose IT, is it Lose It, or I don't know what I'm pronouncing.
Lose it.
So again, because I think one of the challenges for most of us in the Western world is we came from Africa looking slim, and now we have put on so much weight, and we are fighting with it. We don't know what to do, taking on different diets, wanting to do physical things. So how does the STK Lose It work?
Yeah, Lose It is a kind of compact formulation from extract, which is also from food extracts from Cameroon and plants from West and Central Africa. And you may have heard of, Evinia gabonensis. And you may have heard of the common okra. We extract weight-losing substances from okra and Evinia gabonensis, and we pack them together after doing all the necessary in vitro studies, toxicology, making sure that it's safe, looking at the phytochemistry, and looking at a bit of other pharmacological analysis. And we had just come up to observe that some of the extracts of nutrients that we're talking about actually increases metabolism. So when you eat food that would normally digest in 1 hour, it takes about just a few minutes for it to digest. So by that mechanism, it simply means that you feel hungry, you want to eat, but you could just eat just later, just to carry you on. But the body is not getting what it's supposed to get. And that way, it's another strategy for shedding your weight, or for shredding off your weight. Another mechanism there for some of the substances is what? It also generates loss of appetite. So it's an appetite suppressant. So now you just feel like you don't feel like eating. That urge to eat doesn't come that frequent. And then by that strategy, you're also losing, you don't eat, and the body requires a nutrient for it to move on, but you're not feeding the body. And then what is being in reserve gets broken down, and of course you shred off that weight. So these are the two mechanisms in which we have our substance built into STK Lose It. And we've had some very good results with people losing their weight. Of course, weight loss is very tricky. If I must say that, it's very tricky in the sense that it varies from person to person and in certain circumstances as well. So, but the point is that STK Lose It is very good. You are losing weight, through these two mechanisms I've described, but at the same time, there's a certain level of immune boosting. So your body cells are also being nourished to be fresh, to keep up within the period that you're losing weight. So our formulation has also a certain percentage of immune boosting substances also in there. So that's all about that I can say about STK boosted, lose it, sorry. Uh, so a weight loss, but with an immune boosting component as well. Thank you.
So are these products available in Cameroon? If somebody wanted to get them, what is the best way? Are they sold in Cameroon, or we all have to order them? Are they sold anywhere else apart from where you are in Nigeria?
Yeah, they are sold in Nigeria, and then I have some few in Cameroon. So we ship them to Cameroon, and you can actually pick them up from Cameroon, because we have the Phytobiotechnology Research Foundation in Cameroon, which is where all this started. Because we set up a research foundation, and we're doing this research partly there, and then of course partly in Europe and America and Australia, for extensive analysis of certain components that we are unable to analyze in Africa. So we did them that there. So it all back the clinic, of course, in Cameroon, and the foundation is still going on, and we do ship some of the products there. So yes, you can get them either from Nigeria, or you can actually get them from Cameroon. Yeah.
Where in Cameroon is this the research?
In Bamenda. You can get it in Bamenda. Yeah, we have our staff are still working there, and they are actually carrying on with the activities of the foundation. So we can get it. As I speak, I think they told me there are 2 bottles of the weight loss product still remaining there right now at the moment. If you think you have someone who can pick it up, fine. I think I can spare you some of that.
Absolutely. Absolutely.
Yes.
I need some of them.
Some of the bottles are there. Yeah, and it's each bottle or each container has about 40 capsules, and then you take them the first 2 days you take, and then you skip a day. Then once you notice that the weight is shading off, then you can now take it once or twice a week. So that's that pattern. You follow that particular pattern.
So, Prof, I want to first of all say congratulations on your award. For some of us, we don't believe in anything Cameroonian, but I think that for Cameroon, the Medical Society, to be able to recognize you for the great work and just describing, going through the list of things that you have accomplished, and I'm sure that is just a tip of the iceberg. I am going to work out again for you to come on and just talk about what you have done, because I think very often we shy away from wanting to celebrate our accomplishments and want people to come and say these things when we have died. But I think this for me is, personally, I've often told you this. We went to the same, I spent 2 years in Sacred Heart. We're in Sacred Heart College together, but I think that part of this success story is something that we need to be laser focused on, not just for the sake of celebrating your achievement, but it is something that for younger ones, people who are looking for a role model, people who are looking for, hey, what can I do in order to improve on myself? This is something that somebody can look at this and say, oh, wow, Professor Kenneth and Chang did it. Why can't I not do it too? And particularly with respect to the fact that you were not just regurgitating some Western-styled education that you have, you were privileged to have attained, but you took that and you now came back and say, how can I look for Afrocentric solution to the problems? Afrocentric research, which is something that our continent badly needs today, and I think initiatives like yours, and I'm sure there are many that we may not know yet, but initiatives like yours are things that we need again to celebrate what is happening on the continent of Africa. I often say every time I meet you, I feel privileged. I'm looking forward to coming over to Nigeria to the factory, so that we can do some much more work on this. But again, I really want to take time to say congratulations, and congratulations to the Cameroon Medical Society for recognizing the hard work, the accomplishments, and I feel being in your presence and in the presence of a great man. And I thank you for the time that you spent with me today. Any last words?
Well, my last words would be...
Just before you give your last words, Prof, would you, just because we did a lot on COVID, we spent a lot of time talking about COVID and Africa, would you, for the sake of the audience, given all that is coming up, what would you advise people who are in Africa to do? You know, because again, I think maybe people have just fallen back onto just saying that this thing is not existing. It doesn't exist on the continent. What would you advise people in Africa to do? And for those of us who are on this side of the earth, what should we also be doing? Then you can get to your last words.
Yeah, my advice is COVID is real. COVID is there. So we need to adhere to the protocols that have been laid down, maintaining physical distancing, at least 1 meter, you know, following sneezing etiquette, making sure that you don't sneeze, openly in the air, but you have to cover your nostrils, your mouth before sneezing, and yawning. Of course, making sure that you wash your hands with soap under running water, and you use your hand sanitizers and put on your face mask. These protocols laid down by WHO are very important for preventing COVID. I think we need to adhere to this. Secondly, for this cuts across, everywhere in the world. For Africans, continue to use these protocols, but also continue to eat healthy foods. And of course, the spicy foods and the nutritional foods, therapeutic foods that most Africans have been using, I would like to still encourage them to have this as a supportive strategy to support already the existing protocol. So I would advise that. And of course, we should live healthy. And not only for COVID, because also we do understand that underlying diseases in Africa, but like diabetes, of course, cancer, hepatitis are also comorbidities for COVID. So Africans, we should learn to prevent this disease, of course, and follow all the guidelines laid down by WHO for preventing COVID-19. And in the West, the same. For all of you in the West, the same. Please, spicy food, basic kitchen spices that are there in your kitchen, apart from following the COVID protocols, also use them because they are very, very helpful in boosting the immune system. Please stick on to that. And I'm sure that we would overcome COVID in the near future. And then, of course, my last words is words of gratitude to first to you, Lambert, for being inspirational too, because you've been calling me. I've not been a very I would say media friendly person, but recently I find myself now on the media. I've not been that kind of person that really loves kind of public appearance, but of course it's good to communicate, like you've said, to be able to inspire other generations also coming behind us, and also to inspire our colleagues as well, and to learn. Learning is something that we always obviously always continue to learn. So I really want to thank you. I really want to thank colleagues of the Southern Cameroon Medical Society, and to thank the Medical Society of Cameroon as well, Cameroon Academy of Sciences for this recognition and being able to make it very, very big. And of course, I thank our fellow Cameroonians, of course, Nigerians here, where we've been working together. I think if we do collaboration, if we work in the spirit of Ubuntu, that I'm here because you are there, and you are there because I'm here. If we're able to have this collaboration in science and making the world a better place, we'll be able to succeed rather than living in competition. So my last word is more of collaboration, kind of collaborative spirit, and that we need collaboration even in different disciplines, because the problems we may have in one discipline could have their answers in another discipline. So we need to come more than ever before to collaborate. With this note, I'd like to express my gratitude once more to you, and to tell you to continue in this hope and that there will be light and energy at the end of the day. Thank you very much.
Thank you very much, Professor Kenneth and Chang. And ladies and gentlemen, again, thank you for the time you spent with us. If you missed anything, Africa missed the bullet, and we learned quite a lot from why that is possibly the case. There's some hypothesis. I was unable to play that, but I'm going to encourage you to go to YouTube and look for Malumu Deluca. I think that's how she's called on
YouTube.
on YouTube. I'm going to try to get that video on after this onto my site, so that you can follow that. It's important. COVID is real in Africa, the United States, in Europe. COVID is real. Let's not put down our guards. Let's follow the protocols. There are things that the scientists have asked us to do. Wear a mask when you're in public. Make sure you are putting it on appropriately. Wash your hands regularly. Physical distancing. I don't know why it's called social distancing, but physical distancing, making sure you're staying away from people. But in addition to that, your ginger, garlic, lemon, all those things are still very relevant. And I know Professor Chang mentioned here the last time, be careful how you take them, because there's a danger of overdosing on those things too. They go and create other problems that were not there in the beginning. So take note of those. While people are encouraged to take those, I also learned something about cloves. I did not know about cloves. My sister introduced cloves to me, and that's great. So lemongrass, cloves, garlic, lemon, and let's also not forget our traditional medicines and all that. And again, Prof mentioned something about integral health, not just vaccination, just focusing on wanting vaccination, but let's look for a plurality of things, of ways of combating it. That's why we are talking about doing the scientific things and also doing the traditional things, isn't it? And when it's time, if you feel safe with it, go also and have the vaccines. And again, let us learn to celebrate Africa. Let's celebrate what is truly African by celebrating a renowned professor like Professor Kenneth Chang. He has products. Go to the website STK-Biotech and look for those products. Order them. Let's consume African. Thank you all. It's been a wonderful Saturday spending this time with you. I will be on again on Monday. This time around, I'll be doing a book review written by Prince Kafine. That's somebody who lost his son 2 years ago and has written a book on how to deal with that grief. I'll be on Monday with him to review that book, and so that we all can benefit from that. Until then, thank you, good afternoon, and a good evening.
Thank you very much. We'll catch up. Thanks a lot.
All right.
I appreciate